looking at expanding that team. So my hopes are that perhaps some of the fellows that spent their summer with us will be interested in a career in public health and potentially join us. I'm going to turn it over to Jenny Bartlett-Prescott. We want to talk a lot about testing today and then open it up for questions.
Thank you, Dr. Haushalter. Good afternoon. So as Dr. Haushalter said, my primary role with the Joint Task Force is in coordinating the many partners that are offering community test sites across Shelby County. So on behalf of that task force group, I have a few updates to offer. So we are experiencing limited access at our community test sites due to two primary reasons. The first, of course, is increased demand. We have more people seeking testing than we ever have before, and that, of course, produces increased volume trying to come through our sites. But the second thing that has been a more recent shift is the national shortage that we're seeing in test supplies and reagents for laboratories to use to process the tests have now hit our local community. And our own local labs that support our community test sites are limited in their ability to expand their services to address this increased volume of people coming in, and limited in their ability to process the amount of tests that are coming through their labs. And so that is why we're seeing delays in test results coming back. Our normal target is 48 hours, where we want to be able to give test results back to people receiving testing at our community sites. And many sites, that is expanded to 3 to 5 days, and some even longer than 5 days. But we are seeking and planning options to increase our testing ability around our community. There is good coordination, there is good communication among our local labs, the health department, our community testing partners, and the Joint Task Force. And as we identify solutions, I can assure you we will quickly implement them and put them in place as fast as we can. So in the meantime, there's a few key points that we believe it's important for the public to understand while we work towards solutions to increase testing access. The first one is that our testing sites are following CDC recommendations. Now that we are seeing limited access to testing, we now need to prioritize who can be tested and how we schedule people in for tests to make sure the people who need it most get it first. So the first priority are going to be people with symptoms. Folks who are symptomatic, we're going to want to make sure we can try to get them in for testing. The second priority will then be people who have known contact with or close contact, which means you were within 6 feet, 6 feet for 15 minutes. It would be defined as a close contact of a known positive case of COVID. That will be our second priority to try to get in. That means that there is incredibly limited access for asymptomatic testing. People who are seeking testing and do not have any symptoms and do not have a known exposure are unlikely to be able to access a test at this point. We hope that will change as quickly as we can put solutions in place. In particular, we want to ask the employers of our community to please not require your employees to get tests in order to return to work. That is creating additional volume into our test sites, and it is also delaying people from being able to return to work when they're not able to access those tests.